Welcome back. Let's Get Physical Therapy is an educational podcast brought to you by MedStar Health and hosted by me, physical therapist Becca Schumer. I will be sharing the mic with tons of healthcare professionals with the goal of educating and inspiring fellow PTs and future PTs. We hope you find this both informative and inspirational, ultimately optimizing how we treat our patients and grow as professionals. Please enjoy today's episode. It's still May, which means we're continuing with our series to honor Mental Health Awareness Month, which brings us to our next guest, Bryan Kaplan. I've gotten to know Bryan a little more over the last few months, and I know he's very passionate about this topic. Bryan Kaplan attended the University of Maryland College Park and received his Bachelor of Arts degree in journalism with a minor in exercise science in 2002. During his time at the University of Maryland, Bryan worked as a certified personal trainer through the American College of Sports Medicine. He earned his Doctor of Physical Therapy degree and then an advanced certification in manual therapy from the University of St. Augustine in 2008 and 2009, respectively. Bryan now serves as Regional Director for MedStar Health PT at the following clinics. He's got Ellicott City, Goucher College, Hunt Valley inside U.S. Lacrosse Headquarters, Pikesville, Timonium, Towson University in Westminster, and he also takes care of the Baltimore Blast indoor soccer team players. I am thankful for Bryan for spending some time with us today, so let's jump into it. Bryan, welcome to the podcast. How are you?
I'm good, Becca. Thanks for having me.
Sure. I'm excited to continue on with this May being mental health awareness and interviewing you and a couple other PTs and docs to talk about this very important subject. So thank you for joining us.
Absolutely.
So we talked to Karen, physical therapist, about the importance of mental health within ourselves. And I was hoping you and I could get into the importance of mental health in our patients and how that affects how we treat our patients. But first, I want to hear about how you got into PT. I love hearing people's stories, so I want to know what brought you into the field.
Yeah. How much time you got?
I can edit it.
No, it's a long story. I actually have a bachelor's degree in journalism. I went to University of Maryland College Park and got my bachelor's degree in journalism. But on the side, when I was in school, I had worked as a personal trainer. So at age 16, I started working at a gym so I can get free membership at the front desk. And by the time I turned 18, one of the personal trainers there said to me, "Hey, look, you can make more money being a personal trainer." So I went ahead and studied and sat for a test, and hey, this is your bicep. Hey, this is your tricep. And I became a personal trainer. Not speaking badly about the profession. That probably sounded bad, but it was very simplistic for an 18-year-old. So I started working out. I always remember that the first patient that I saw had OA. I had no idea what OA was. And I had her doing walking lunges across the floor for knee OA. And I still kicked myself for that. But fast forward, I went through college. I worked as a personal trainer and did journalism. And then when I graduated, the day I graduated, I walked out of graduation, and the personal trainer who I spoke about earlier, who had recommended me to be a personal trainer, called me and said, "Hey, listen, I just left where I'm working. I'm going to work for University of Maryland Physical Therapy at Kernan. They have a wellness program, which is a step-down program, and we'd love to have you come work for us." And I was like, sure, that sounds great. And so I kind of just threw my journalism degree to the wayside, and I started working for them. I worked in a physical therapy clinic, which was amazing. And we did step down for patients who were discharged, and they did exercise programs that were medically based. I did that for about 3 years, at which point I became close with some of the therapists there. One of my mentors said, "Hey, you should go to physical therapy school." And I did. And the worst part about the whole thing was because of my journalism degree, I had to go back and I had to retake all my prerequisites because I didn't have any of them as a journalism degree. So I had to go back and take anatomy, physiology, chemistry, biology, physics. That took me 4 years to do that while working. So got through PT school and here I am. But I'm a huge proponent of having students and having people do internships with me and learn, because it was hard for me as a 18, 19-year-old to determine this is what I'm going to do with my whole life. I was never the type of person that, had it all planned out. And so it's good to see through internships and through opportunities if this is what you really want to do, because I don't want you to do like I did. I want you to come out of school at 22 and be raring to go.
That's something I really appreciate in you, is that you always open arms for students to come and learn from you. So I appreciate that.
I mean, just the experience I lived through, I want to share that. And I think that ties into our mental health discussion.
Yeah, so that's kind of a nice intro. Like, why mental health? Why is this so important for us?
Yeah, again, as a new grad therapist, I mean, just to backtrack a little bit, in PT school, we don't talk a lot about this kind of stuff. A lot of it's, physical in nature and neurological in nature. And, I started as a new grad PT, and I started working with obviously patients who were in a lot of pain, patients with chronic pain. It never really dawned on me that like the mental health piece really played an integral role in all of that. It wasn't really until I personally started struggling with my mental health, from stress, from burnout. Just to be candid, I've gone through a lot of those things, and taking the time to study, and learn about mental health and understanding how stress affects the body and all the adverse effects that happen with, you know, a huge cascade of a sympathetic chain response that just never goes away. Like something just clicked in my brain, and I thought, wow, like I think about all the patients that I'm dealing with every day that are going through this. I need to incorporate that as treating the patient as a whole and not just treating them as a knee or as a hip. It's a whole person there. And I think that really changed my approach to patient care. And I've seen huge changes just from doing that.
Personally, myself, I feel like when I graduated PT school as well, it was, we learn about the joint above and below and really focusing on the injury that they're coming for. But for me, many years ago, I started listening to a podcast actually, and it was a bunch of personal trainers, and they started talking about like all the other aspects of health and its impact on someone's recovery. And it kind of like light bulb moment in my head. I'm like, oh, like I'm missing the boat. Like if I'm not addressing these other things, I can give them all the things to do, but if they're not taking care of all these other things in life, then really what does it matter if a patient can do a quad set if they're not sleeping and they're not taking care of themselves and they're miserable at their job and all these other things? Like what I'm doing is so basic and not really going to impact them.
Absolutely. Yeah. I mean, I remember in graduate school taking a pain seminar, and then speaking about pain and how it manifests and how it affects the body and how everybody's different. And I really have utilized that a lot. But again, I think really when I started delving into the mental health piece for the patients, it went a long way. I mean, again, as a therapist, outpatient physical therapist, I see a patient for 30 minutes, maybe an hour if I'm really, really lucky about it for the day. And I see them 2 to 3 times a week for weeks on end. And so you start to build that rapport and you get to know the patient as a whole. And a lot of patients start to talk to you and tell you about things in their life that are going on. And I spend that time educating. Listen, you're with me only for that minute amount of time in your day, and you're with yourself the remaining. And I started thinking to myself, how can I help you outside of these walls instead of just giving you a home exercise program? What can I do in addition to that home exercise program? And it is like you talked about, talking about sleep. Again, we got our total knee replacement. I keep using that as an example because it's an easy one, but they're in a lot of pain and they're in chronic pain and they're not sleeping at night. Well, what's your rest and restore mode tell you, right? If you're not resting and restoring, your body doesn't have the little firefighters and construction workers in there getting everything fixed up. It's struggling a lot. So I'm a huge proponent of trying to get people to sleep. I don't care when you sleep during the day, take a nap. Like you need to give your body that chance to rest and recover. And then with our patients that are, our weekend warriors and our athletes that are just out there doing and doing and doing and never giving themselves a chance to rest, and our athletes with overuse injuries, there was so much that just kind of tied together for me of, hey, you really need the rest component because that plays into your mental health and that plays into how you recover.
You talked about the importance of building that connection because we do see people often twice a week, rarely 3 times a week, but we're having these conversations, getting to know them. How do you get that buy-in if you have that patient that's, Brian, I'm just here for my knee. Like, what are you talking about? Sleep and all this other stuff. I just fixed my knee. How do
Yeah.
you start to integrate these other things
Yeah,
into the conversation?
I find a lot of it is patient education. So I spend most of my time focusing on the patient education, the patient rapport. Most patients, when they walk into a physical therapy office, they have no idea what to expect, or they've been told a certain thing. Some of them come in already stressed because their friend told them therapy was painful or whatever it was. So I always like to spend that first visit kind of setting expectations of what this is going to be all about. What does it look like? What does our care team look like? Because that's another stressor for people. Like people come in and they see us for an eval, and then we say, oh, by the way, you're going to be seeing a PTA for your follow-up, or I'm not here next week. That's a stressor for people. So I have kind of really taken it to heart to say, listen, like, I got you. This is what we're going to do. This is the plan. Really spend a lot of time educating on anatomy and physiology and the underlying source of what's going on. And then really I get a lot into the differences between the sympathetic nervous system and the parasympathetic nervous system. And like I said earlier in the conversation, I've found in working with more patients that, yeah, most of these patients are living in their sympathetic body. They're not at all able to get into that rest and restore or that rest and digest mode. And how can I help them to do that, right? And so much of it is education. And I find works for me that like the more I spend time connecting with that patient and educating that patient, it builds their trust, right? Like you said, their buy-in. I want to earn their trust by demonstrating to them that I'm a human who cares about them. And you'll find a lot where patients don't get that in the medical field. They feel like they're just a name or a body or a number. And that's an awful feeling to have. And that plays into the mental health piece. So when you have that one-on-one time with the patient to sit and actually listen, that is a huge part of it, just listening to a patient. Because they don't always get that. They don't get that at home. They don't get that at the doctor. And so I'm sure we all have that patient or more that we can think about that just wants to talk and talk and talk. And that's okay. Like they need that. And that helps them.
And it's as a New York grad, when I would have a patient that would just talk and talk and talk, and we learn about in PT school, you have a budget and you want to ask the right questions and kind of redirect. But for
Yeah.
that patient in that moment, that's what they need. And if you stop them or interject or, I don't know, dismiss what they're feeling, even if to you, like, okay, that's not the most important thing for me to treat at this moment, but for them it is, and that's what matters.
Hmm.
And just making that eye contact, putting your computer away, having
Hmm.
that one-on-one time is so critical to get the
Yeah.
patient to trust you and commit to the rehab.
Yeah. And I really love when the patient has that like aha moment. Like you can tell when they have it, especially like through patient education, which is super powerful tool that we all have. Um, just having that conversation with a patient who walks in who's in chronic pain and you start explaining the sympathetic cascade and what happens to their body and what symptoms they might have. I might pull up a Google document of a referral pain area and show them what it looks like. And then the patient's like, oh, wow, that makes so much sense, right? Like if your muscles are guarding, then this is happening and this is compensating and then that's happening. And that's why you feel the way you feel, especially for chronic pain patients. If we addressed it acutely, you probably wouldn't have gotten this far down the road. So let's back up. Let's get you back going in the right direction. And we have to incorporate the mental piece. Like it's a no-brainer that you have to include that.
I know sometimes we're pressed for time, like we see a set number of patients, and sometimes maybe you start to pull away from that side of it, and
Sure.
you're treating this injury and it's not getting better. And when you take a step back, you're like, what am I missing here? Like maybe there's something else going on here in life. Like I had a patient that had an ankle injury, and how she was presenting just didn't correlate to like what was done or where she should be, I'm quoting, should be in her rehab. And come to find out there's just a whole slew of other things that were going on that were setting off her alarm system, and that was the most vulnerable area, so that kind of hit the stress, and it was just
Mhm.
this vicious cycle until we kind of address those things and educate about that alarm system and that sympathetic nervous system. Things weren't
Yeah.
going to get better.
Yeah. Absolutely. I think that makes so much sense. I had a patient recently who was a lot of these patients that you'll see, like for example, someone who was in a motor vehicle accident or some sort of trauma, like a fall, and then they just kind of fall into this pattern, right? They're out of work or they're now depressed, and it all goes together. So you have to look down that avenue and recognize what can happen when someone gets hurt, right? Like you're taking them away from their job, from their family, from their life, from their sport. Of course there's a mental health component there. But more recently, I have a patient that I was thinking about. So I've been seeing her for a while. She had a car accident, so much stress at work. We talked about that a lot. She was always keyed up. She would feel better after she saw me. And then she would say, Bryan, it was great for 30 minutes. And then I left, got my car, went home, traffic, stressed, you know, felt symptoms again. Okay. Well, she happened to go away on vacation for 1 week to Mexico with her family. She came back and she said, I had no symptoms that whole week. I said, yeah, think about why. Like, what was your stress level like? You were probably just living in it, doing your best life. And I think that was her aha moment of like, wow, like I can't believe how much the stress has affected me in my job, in my life, and my everything. She went as far as to go and take a yoga certification, and she's now working towards that. And she's like, man, this has been so helpful to like figure all this out. So again, just like a little bit of push can really direct somebody to change their life. And that's going back to your original question of like, how'd I get into this? Like, I didn't realize the impact we can have on people's lives. And it's so powerful when you get that mental health piece clicking for somebody.
Definitely. And I'm just thinking about when you have a patient and we know that, like, if you do these 5 things, you're going to crush it, you're going to feel better, and blah, blah, blah. But if they only have the capacity, the headspace to do like 2 things,
Yeah.
then that's fine. And so I try to have conversations with my patients, like, realistically, like, what can I give you? Like, where are you at? Because I want to meet you where you are. And eventually I'm going to push you, like, once we get to know each other and I know like how I can push you and how to appropriately do that. But if we kind of throw a bunch of things onto our patients and they're, again, they have this wall up and nothing's going in, then we're sort of wasting our time.
Yeah. I mean, again, I always tell my patients this. It's really hard to treat your brain, right? Like I can't do that, right? I can't put my hands on your brain and massage your brain and make your brain feel better. So I can give you the tools to do it, and you got to do it. And there's so many different ways to do it, and everyone's different, you know. But I incorporated a lot of like diaphragmatic breathing into my treatment, meditation into my treatment, right? So we talked about a patient who's having a lot of chronic pain, who I just spent a lot of time doing manual therapy on them. And then they did some exercises, and I might throw them in a treatment room with the lights out and just say, hey, listen, I'm going to throw you into parasympathetic mode for 10 minutes. I don't care if you don't get any more today. I want you to get that right now for 10 minutes. Throw them in a room, have them just lay there and do belly breathing, simple, basic. If the patient wants to take it up a notch on my phone, I might use a podcast of, a body scan or just a breathing meditation or any kind of meditation. And we just started incorporating through Hyperice a device called the Core, which is an awesome handheld device for biofeedback where the patient can hold it. It vibrates with their breathing. It walks them through specific meditations. And, to have a patient walk out of here and just have like 15 minutes of respite is, again, it goes a long way.
Are there any other tools you're utilizing for the patient when they're outside of our clinic?
Yeah, absolutely. I mean, I'm a huge proponent of like podcasts or apps on your phone, reading like books on tape, talking to people about when you're in the car, like maybe just throw on a podcast of some sort of mental health conversation. And that's great. Obviously, breathing techniques are wonderful. I take it as far as the things I learn. I talk to people about things like mindful eating and just mindfulness in general, like being present with your home, with your family. Again, I'm not a psychologist by any means. I always preface any conversation with any patient by saying I am not a mental health professional, but these are some things that I do and I've learned and that I think work for me. And I would love to have you try some if you're interested in and share with me if there are things that you do that work for you, because I'm always working on my mental health and well-being because stress is everywhere. And I think it's important to recognize that, yes, stress is all around us, but how we let stress interject in our lives is what gives stress its power, right? So it's easier said than done, but like I would love to like not give stress any power.
I love that. I like the presence conversation. If our patients aren't present in our clinic, then again, I don't say waste of time. It's not a complete waste of time, but we're not getting as much as we could out of it. And I think that goes back to that education piece of getting buy-in and the patient understanding like why we're doing what we're doing. We're not just doing these things for the fun of it. There's a reason behind what we're trying to have them do and learn to do to help themselves. So how do you have your patients in the clinic in a treatment be present?
Yeah, I think a lot of that is one-on-one care and doing the best that we can, utilizing our care team, me as a therapist, right? I might get 30 minutes one-on-one with that patient. During that time, I want to set the expectation for that visit. I want to talk to them. If I do have to go see another patient, I want to continue to follow up with them, but I want to set them up. Hey, listen, this is my clinic assistant. She's going to help you go through the rest of these exercises. If you have any questions, obviously pop back to me. But again, I think setting the expectation is huge for them. But just talking about being present, like focus on breathing with exercises, right? So the inhale component, the exhale component, what are you feeling? Like making them listen to their body, right? So something we're taught in school, but I think we neglect a lot is like, where do you feel that, right? So go ahead and stretch your hamstring. Where do you feel that? Like, make sure that they're feeling their body. That's a huge thing for anybody, because I think most people who are new to therapy or new to exercise might not expect or know what to expect. So when they do an exercise, oh, that hurts, right? That's okay. Like, that's normal, right? You're stretching a muscle, we're working a muscle, we're working on balance. Like, those things are all fine. And I think continuing to have that conversation helps somebody to stay present, because people get really quickly rattled when they're like, "Oh, that hurts. I don't want to do that anymore." And we got to kind of get them back in their lane.
I like to have the patient put their phone away because,
Absolutely.
especially the kids, they're like doing their dynamic warm up and texting their friend or trying to get
Yeah.
concert tickets. I'm like, put it
Yeah.
down, like
I know.
presence.
Yeah, that's hard for everybody in life right now to just be present, especially with phones and social media and everything. So absolutely, like, we want our people when they're here to just be focused on themselves, right? You're here for the next hour. You don't have your job, your school, your family, or anybody to worry about. Now's your time to focus on you. And that's really hard for people, like really hard, but you just kind of keep pushing that envelope with them of, hey, got to take care of yourself. It's okay to take care of yourself. And again, like I said, I'm not a mental health expert whatsoever, but it's very clear, right, how the brain just controls so much of pain and recovery and motivation and all the above, right?
Yeah, with regard to that, like the conversations we have in our head or the negative thoughts that just constantly pop up. And a tool that's been really helpful for me is just reframing. So if something bad happens, like, oh, that hurts. Well, maybe it's a little painful and I'm getting stronger and I'm not doing damage to myself. And this is going to help
Yes.
me do X, Y, and Z. So
Yes.
helping patients like
Yeah.
reframe is huge.
Yeah. I mean, it's gonna be okay, right? I know it hurts. It's okay. I promise you, we're not doing anything that's damaging anything. You're stiff, you're sore. That's normal. Like, using words like that to make them feel comfortable, to feel safe, right? It's normal. It's okay. You're gonna get there. Like, I know it's gonna be better. The other thing that I do too that helps is sometimes I'll bring in another patient who's in the clinic, who is further along in their rehab, and say, hey, would you mind speaking to them, briefly? And then I go to my patient, would you mind if another patient speaks to you briefly about her recovery? Because that commiseration or camaraderie or whatever you want to call it helps as well, right? Because again, patients are not alone. Like, we're here, it's a clinic, we're busy, there's lots of things happening. So, you know, integrating everyone together is sometimes a good thing and sometimes
It,
not, right? There's other times where I know somebody just wants to be in a room and doesn't want to be bothered, and that's fine. So understanding what your patient's needs are is crucial.
I love that example. I love having someone who is fresh out of ACL surgery, it's their first or second visit, and then we have someone that's 8 weeks, 12 weeks, whatever down the road.
Yeah.
And when they're in that first, second visit, it's really hard to see down the road that they're going to be doing all those things in a relatively short period of time. So I love bringing them together and
Yeah.
chatting and giving hope and optimism that things will get better.
Yeah. And then another thing that I would add is, I'm like thinking, and I would say an observation of you, you're really good at this, making it fun for the patient to be there, right? People don't want to come to therapy, at least the high majority of them don't. And so we want to make it fun for them and do things that are functional, make it interesting for them, figure out exercises that motivate them or drive them. Um, and ensure that you have a team that treats everybody the same way, like a family. Um, the camaraderie of the clinic goes a long way for the mental health of everybody. Because if you're a patient and you walk into a clinic and it's a stressful environment, you can feel that, right? And that doesn't feel good. So, as a leader for my team, I want to ensure that our clinic atmosphere is such that it's just very light and patients feel comfortable here. And I don't want to be the one creating stress for a patient. There's
I
enough out there.
I was just going to bring this up of the importance about the atmosphere, and in Hunt Valley inside USA Lacrosse, we have the music going, we're having a
Yeah,
good time. My patients are talking to John's patients, we're all conversing, and
yeah,
it's just a nice, happy family, and people feel safe and invited, and just reiterating what you already said.
yeah. And when we get those reviews that come in that say what a great team or what a great experience, like those are the things that make me feel good, because ultimately we're here to help people. That's the common denominator. And so anything that we can do to help people from the physical aspect, from the mental aspect, I'm going to go out of my way to learn how to do it and figure out how to be good at it.
We're talking about all these happy things, helping patients get better and improving their mental health. What do you do when you have a patient that's really struggling, that you've given a few appointments and you're just not chipping away? It's just not going the direction you want to see it going. Where would you take that?
Yeah, it's a great question. I really focus a lot outside of work on how I can help people to get better. So, look, I'm a perfectionist. I'm not going to lie. So, patient comes in and I'm doing something and I'm just not getting to where I want to go with them after a couple of sessions. Like, I'm immediately going to start thinking about what else I can do differently. Um, Maybe reach out to one of my colleagues, either at my site or another site. Hey, I'm working with this patient. It's challenging. Do you have any other ideas? Let's get another set of eyes on it, another set of ears on it. Maybe even have that conversation with the patient. Hey, listen, like we're kind of struggling here. Like, are you feeling that? Because I'm going to be honest with you. Like, I want to get you better. And it's killing me that it's not getting you better right now. So, would you mind if one of my other colleagues came in and take a look and talk to maybe they can see something different that I can't? Um, and kind of go from there. But then also just building that trust with the patient and continuing down that road of like, listen, I know we're struggling right now. We're going to get through this. Let's keep working through some things. Stay with me on this. But today we're going to go in a different direction. So I know last time we did this, but today I'm going to try this. And let's see how we do with that and come back and give me your honest feedback, because I'm here to help you. And if you feel like this is not helping you or not getting you better, I need to know, right? And if it's a musculoskeletal issue or something that your body's triggering, I'm 100% going to get to the bottom of this. But if there's something else going on, then we need to determine like who else in our collaborative care group can we get you to? Is this something that you need to see pain management for? Is this something that maybe we need to get more imaging? But yeah, there's definitely patterns that like things should be moving in the right direction. Um, yeah, that's like a long-winded answer, but there's I personally like the challenge of the patient who's not getting better, because I like using my brain, my clinical judgment, trying to figure it out. That's a huge win for me when I can figure out chronic pain and get it better, but it's really challenging.
But I mean, it's awesome. You call yourself a perfectionist, and I could
Yeah,
see that going a negative way where you're
of course.
just trying to keep plugging away and doing the same thing and
Of course.
not getting where you need to go, versus being humble and like accepting, like, okay, I don't know everything, but I have colleagues and resources that will probably be able to help you or look at this from a different lens and go that route. And then you learn from that. So it's a nice little
Yeah.
cycle.
Yeah, I mean, we are a team. That's the bottom line, right? So I always tell people, I don't care who gets the patient better, right? I don't have an ego like that. Like if I'm struggling and somebody else can get them better, awesome. Because again, common denominator, patient. I want to get the patient better. If my front desk gets the patient better, awesome. Like I love it. But as a team, collectively, it all comes from there.
What do you do with the patient that sort of has unrealistic expectations and they're on kind of this other spectrum where they're rearing to go and they don't have these like pauses or rest buttons or just
Yeah.
any reserve on what's going
Yeah.
on?
I mean, first thing I usually do is laugh at them. I mean, we get these conversations and I'm like, seriously? Like, you want to go back and run tomorrow? Come on. Like, help me help you. right? So here's what I would ask. Like, if you trust me, here's what I would ask. Let's do what I'm trying to do for 3 sessions. Can you give me that maybe over the next week and a half? And I want to know what I'm specifically doing is helping you, right? Let's say you come in, you see me, you walk out of here and you're feeling awesome. You come back and see me and tell me that you're feeling awesome. That's great. Like, I know what I did here. But if you walk out of here and go back and run or go back to work or do whatever you were doing and come back and say, oh my God, Bryan, whatever you did last time I hurt, I don't know. Was that me or was that you? So we got to kind of keep it in a bubble to start with and figure out what is it specifically that's causing your symptoms, right? And then I try to talk through a day with the person. So let's make a log of this. Wake up in the morning, how do you feel? Getting out of bed, how do you feel? Morning routine, how do you feel? Going to work, how do you feel? Coming home from work, going to bed at night, and kind of working through that day to figure out what's triggering your symptoms, and can we address those, right? Because again, I would go back to the point that like the patient is with themselves 99% of the time. They're only with us for a minute amount of time, and we have to figure out what is it specifically that's triggering their symptoms. I don't know if that answered your question.
That was good.
Yeah.
Well, how else do you get buy-in from your patients? I know I like to really get the patients involved in their own goal setting and get a deep
Yeah.
dive into like what they're truly trying to get out of our time together. But are there any other tools that you use when conversing with the patient to get them to perform how you're hoping they will eventually get to?
Yeah, again, I think you're right. Like we want to incorporate the patient in the plan, right? It's not our plan, it's the patient's plan. And so figuring out goals, making things functional, working through everything from ergonomics to body mechanics. Again, like I said, I'm a huge proponent of education. I feel like the more you can educate the patient, and I almost do it too much, the better the patient's going to be, right? And I tell my patients specifically, I'm not going to get you better. You're going to get yourself better, right? And I want to empower them and give them the power to say, you're going to get yourself better, right? Again, I've said this several times already in this talk, but like you're only with me for a small amount of time. You're with yourself the rest of the time. So let me help you figure out day to day, how can you manage your symptoms? Because it's going to come down to you, right? In most cases, I don't discharge people at 100% function. That's very rare. And when that happens, that's like, wow, like that's an amazing day, right? But for the most part, I'm going to tell that patient from the get-go at the eval, I'm not going to get you 100% better. Let's get you to the point where you can take the ball and run with it. I'm going to give you as many tools as you can handle, right? You want 10 tools, I'll give you 10. If you want 5, I'll give you 5. And you utilize those tools to get yourself better. And it's everything, right? It's the mental health component, it's the physical health component. It could be like spiritual health or emotional health or intellectual health. Again, not professional, but I talk to people about these things because again, I want people to see that, right? Like none of us get any of this education. Like we just don't. Um, and it's played a huge role in my life to delve into mental health. So I want patients to be able to understand and feel empowered. I think that's like the word I always use. Like, I'm empowering you. You got this, right? It's your responsibility to get yourself better. And I don't know, I don't get a little pushback on that usually, but in most cases, the patients are appreciative of that. Because I don't think it's an approach that most people take. Most people go to therapy and it's very cookie cutter approach and they're given certain things, or the therapist doesn't even put their hands on them, and the therapist doesn't even talk to them. And that stuff blows my mind. So
Hmm.
I want the patient to walk in my door and walk out my door feeling like they were heard, feeling like they're human, feeling like they were treated and respected appropriately, no matter what they're, coming from, coming for. Um, that goes a long way.
I know Karen talked about the mental health aspect with regards to clinicians, but I'm curious about your perspective regarding the importance of us taking care of ourselves so that we can take care of other people optimally. What does that mean to you?
Absolutely. Is what you just said, right? Like you can't be the best for other people if you're not the best for yourself. So, a lot of our philosophies now, especially in our leadership training here, our aspiring leaders training, our mentorship training, is it starts with you, right? That's like, I like that phrase a lot. It starts with you. You have to understand yourself. You have to understand your patients, right? A lot of people get frazzled when somebody comes in with mental health issues, or they're challenging, or they're difficult, and they want to sit in the PT staff office and, oh, this patient. I'm like, take a second to understand yourself and understand the patient, and figure that out. The patient needs you. Um, and so that is really important. And in terms of burnout and things of that nature, yeah, it's a hard job to work on patients. We're talking a lot about physical and mental. You're working with 15 patients a day. They're all coming in with different things. They're talking about different things. You're absorbing a lot. So it's really important for our therapists to take care of themselves, make sure that they're taking days off, taking vacation time. Don't just keep pushing through. When you get to the point where you feel like you're just not 100%, your brain's not doing what it was doing last week, take a step back. That's okay, right? I think we're so used to being in healthcare and wanting to help people, help people, help people, that we feel so guilty helping ourselves. And you got to get rid of that guilt. That's something that I'm working on a lot. There's lots of good podcasts on guilt and shame and self-confidence. But I'm a huge proponent now. And in all my staff meetings now, we lead every staff meetings with a wellness moment. Check in on everybody. Go around the room. How are you doing? How you doing? How you doing? And just, make it comfortable. Like, there's a huge stigma around mental health. We need to break that, especially in our profession.
Definitely. Yeah, those are great piece of advice. Starting to wrap up here, can you give us 3 top tips that you want people to take away today from our conversation?
Yeah, I think that's number one. You want to look at the patient as a whole, right? So listen to the patient, talk to the patient, recognize, like, where is their symptoms manifesting from, right? That's usually a physiological thing, but then where is their pain manifesting from? And that's usually the mental health piece. Understanding work-life balance, understanding stressors for them, and trying to, again, just look at the patient as a whole, right? Don't just look at them at the knee or the joint above and below the knee. Look at them as a whole. Number two, again, I'm a huge proponent of education. So you want to spend as much time as you possibly can educating that patient and empowering them. And the last thing that I would say is, it's the patient's responsibility to get themselves better. We cannot put the onus on ourselves as clinicians. That plays into our stress. And so I think we have to recognize that we need to be giving those tools to the patient. The patient's got to take the ball and run with it. And then at the end of the day, they'll get themselves better, right? Understanding that discharging a patient not 100% functioning is totally fine, totally fine. As long as the patient feels like they have the skill set to continue with it, they know they still have you, you're not gone, right? They can reach out to you if needed. But I think we have to be better as a profession of empowering our patients to take care of themselves. And we have the skill set to do that.
I want to piggyback off of number 3. I love that you said giving our patients the tools, and again, alluding back to what we've talked about earlier, being open to trying different tools. Like, if something's not working, then find another tool that will work, that clicks for that patient, because we only have the tools that we have, but you might have things that I don't have. You might have a better way to explain it. So leaning on each other to find the best tools for everyone.
Yeah, agree.
Cool. All right. We like to end our podcast with your favorite quotes. What quote moves you, drives you? It doesn't have to be related to PT, but what's your favorite quote?
My dad always said, never say never, when I was growing up. And that's something that's always, like, ruminating in my head. Whether it's, at home or at work or anywhere, like, I always try to do things, right? So to me, never say never is, like, always try to get out of your box and do things. If, something you've never done before, you can do it, right? And just don't close yourself in.
I like it. Bryan, where can people find you? Where do you treat
Like,
patients?
oh, I I thought you were saying, like, on social media.
Well,
Like,
that too, if you
I
want to
don't
share
know
that.
I don't really have, like, Instagram or
That's okay.
Twitter or any of those kind of things. But I'm the regional director for MedStar Health Physical Therapy. I see patients out of our Westminster location, our Pikesville location, at times Timonium and Hunt Valley and Elegant City. If you go to medstarhealth.org, and you can look at some of our physical therapy locations, that's where you'll find me at one of my 7 locations in the area, bouncing around. I love treating. That's my number one thing. I love educating. I love talking to patients and building that rapport. I'm finding that much harder as I'm getting into a more directorial role and administrative role, but I don't want to lose grasp of that whatsoever. So yeah, check us out on our MedStar website, and happy to help anybody.
Great, Bryan. I've enjoyed getting to spend more time with you, learning from you, and I look forward to the future. And thank you so much for spending some time with us on the podcast today.
Happy to do so. Thanks for doing this.
Thanks for listening to the Let's Get Physical Therapy podcast. Be sure to subscribe to our podcast and follow us on Instagram at MedStar Health PT. If you've enjoyed today's episode, please give us a 5-star rating and leave a review so we can reach more listeners just like you. As always, we appreciate your time and hope you join us for our next episode.